I want to say I so appreciated hearing both Dr. Medina Garcia and Dr. Lagoon's presentation. You guys practice in a field of medicine that is very far afield from what I do. And so my presentation will not contain any data because in our world, we don't have the data yet. And so what we're going to talk about tonight is, let's see, which button forwards me? Whoop, whoop, whoop. Sorry about this. We're going to be talking about the unique issues that our children are facing. And so I saw in the participant list, there's a handful of pediatricians, family medicine folks here, but we all have kids. You either have your own kids, your grandparents, aunts, uncles, you have friends with kids, kids are everywhere. And kids have been exposed to some very unique issues from COVID that is different from adults. And in the world of child and adolescent psychiatry, we are all estimating that the second wave of morbidity from COVID is going to be the mental health impact in our youth. So we'll talk about some of those unique issues in kids. We'll talk about how to recognize the signs and symptoms of decline, and then most importantly, what local resources exist. So the first thing, we don't have the data. There are several large studies that are being conducted through surveys of practicing child and adolescent psychiatrists, practicing children's mental health clinicians to try and determine what's happening, but we don't know. Anecdotally, across the country, for example, we have seen an increase in reported suicidal ideation, and interestingly, an increase in overdose presentations to the emergency department in youth. We are not able yet to see the data as to whether or not our suicide rate has increased, but we certainly know here in Clark County that our rates are up. We had an article that was presented in the New York Times recently about the escalation in suicides amongst youth in Clark County, the youngest one being an 8-year-old. This is real, and this is happening around us. So on the one hand, we don't know the impact, and we know that developmentally, COVID is happening at a time with extreme vulnerabilities. Kids' lives are impacted in every way possible, and they don't have a sense of control like adults might have. So it's impacting school. Summer activities were canceled. A lot of extracurricular activities were curtailed. Family life changed. And there's been this chronic trauma exposure that we've never seen before. We've seen traumas in youth. September 11th, the anniversary is coming up. There have been beautiful studies done through the National Crime Victims Center looking at the trauma impact from that event, from proximity to the Twin Towers. We've seen the impact of trauma from hurricanes as an example. But this is a nearly 2-year-long chronic trauma that's impacting us in the news, family stresses, potential death of parents, potential death of loved ones. It's the whole life for children has changed. And so this is the great unknown. We've never had an event in the world of child and adolescent psychiatry that tells us what's going to happen with a long-term extreme disruption in the trajectory for kiddos. And so this leads to a lot of uncertainty. Kids thrive in structure, and we've lost that structure. Although this year, going back to school, there's been more structure, but it's changed. They're wearing masks. We don't yet know how that's going to impact peer-to-peer social interactiveness. We do know that peer interactions and in-person education worsened behavioral issues in kids that were at risk. So a great example is we have a lot of kids on individualized educational plans for mood and behavioral disorder, for neurodevelopmental disabilities, and their resources, their supplemental resources, be it speech therapy, occupational therapy, and class supports were absent during the pandemic. I had so many of my patients that the parents told me they weren't even able to access online education, or their autism teacher wasn't available, or they had maybe 1/10 of the supports that they used to have. We know that for some kids, there's been an inequitable distribution of resources, and some kids have great internet connectivity at home. Every child has their own laptop. Every child's able to get great ability to stream information. But for some families, that's not an option. We've had telehealth visits where there's 4 children sitting at a table. One of them's trying to do a teletherapy visit with our psychiatrist. The others are doing Zoom school, and you hear the parent yelling in the background. It's just not an environment conducive for anybody's success. Interestingly, with the relaxed social distancing and some relaxing in other states of mask mandates, we're seeing in youth increased fears of illness, especially amongst those under 12 who are non-vaccine eligible youth, where somatic concerns, worries about death, worries about illness have really risen. And as I said earlier, a lot of support services when the schools are absent, but also in-home services. So as an example, a lot of our patients with autism spectrum receive ABA, Applied Behavioral Analysis Therapy. This is an in-home therapy that oftentimes can be delivered between 30 and 40 hours a week, focusing on extinguishing certain maladaptive behaviors. In-home services vanished during the pandemic, and so these kids really regressed in a very severe fashion. Not advancing. Here we go. And then I talked about the inequity that we're seeing in resources, and we have a cohort of youth who were lost. So in the Clark County School District, being present and having full attendance required you to log in for about 10 minutes in the morning, and that was it. Furthermore, if you went more than 10 days without logging in, you were disenrolled from the public school. There wasn't a good way to track youth. And on top of that, the lost youth are those who are more disproportionately represented by having struggles with poverty, food insecurity, housing insecurity, and our cases of abuse and neglect. Greater than 80% are reported through the school. It's the teachers, the school administrators, school counselors that are making the majority of the reports to Child Protective Services. And so without this safety net of school, there's a big question as to what's happening and what has happened. We do know that over the last year, and I work predominantly in the adoption and foster care world, there's been a severe drop-off of reports for abuse and neglect that are making it in to Child Protective Services. The final piece is that there's about 113,000 youth who lost a primary caregiver due to COVID. And their ability to grieve the death and loss of that caregiver is different because you don't have the flexibility to have the full funeral, to have all of their family present for support because of our social distancing mandates. And so again, this is another unknown of what's going to happen next. So what do you do? What are the signs of decline? The simple answer is if there's any significant aberration in mood or behavior, any change, you know your patients, the ones that come into your office and are ordinarily cheerful, and then they come in for a sudden wrong, that something seems off. Changes in sleep, be it difficulty falling asleep, difficulty staying asleep, or disrupted sleep. Somebody's unmuted. Keep hearing sounds. Changes in activity level. So a kid who was previously active that might have been on a sports team, that might have gone out and done a lot of things with their friends, suddenly is withdrawing and staying in their room, becoming socially isolated. And then other high-risk behaviors, increased irritability, increased aggression, modifications, not change, but modifications in somebody's overall personality structure. And then most importantly, self-injurious behavior, cutting, burning, doing things to hurt oneself, not necessarily with the intent of killing oneself, but with the desire to release the stress and tension. And that's a behavior that kids engage in. And then finally, academic decline. It was ever unmuted. So what can you do? First and foremost, you want to ensure safety. Safety is key. And so what does safety mean? When we look at completed suicides, the number one way somebody is going to complete suicide and complete it the first try is with a firearm. When I talk to parents about this, I'm very open. I like guns. I own guns. I have a CCW. I'm not going to tell you to get rid of your guns. If you have a high-risk child, I am. I'm going to tell you have it locked up. I'm going to tell you to take it to the gun club, put it in a safe at somebody else's house. Don't have it in your home. That is the number one way. For every time a child attempts suicide, 90% of those with firearms will be successful. When you're assessing youth for suicide attempt, suicidal behavior, be non-judgmental and empathically listen. To just walk into somebody's room, for example, in the emergency setting, who is struggling and presented with a suicide attempt, and to say, wow, sounds like this was a really horrible day. I know a bunch of people have asked questions of you, and I'm just really here to listen. What do you want to talk about? And it seems like, oh my gosh, that's going to be long and drawn out. I've got a short amount of time for a visit. Just that 2 seconds of giving an entry statement, leaving it open-ended for an empathic, non-judgmental response for a kid is so valuable, because nobody else in their life is probably doing that. There's some great educational resources out there. ACAP, the Academy of Child and Adolescent Psychiatry, has a coronavirus resource center with everything you'd ever want to know, information for your parents, information for your own practice. And then the National Child Traumatic Stress Network as well has some great resources. Within UNLV, we have resources. Here's all of our clinics that children can be referred into. All of them are actively accepting patients. And so you'll get a copy of these slides if you want these resources. Our state, and then Clark County specifically, has the Mobile Crisis Response Team. This is free, has nothing to do with insurance coverage. It's all grant funded, where you can get a mental health professional to respond to a crisis anytime, anywhere, 24/7. And then for those that don't want to reach out, oops, don't know why it's not advancing, but there is the suicide hotline, which you can either text or call. Here it is. And so it's a crisis counselor based hotline. This is free, crisistextline.org. Lots of resources out there. I mean, the beauty of COVID, if we look at the silver linings, is that telehealth has flourished. And in the world of mental health, the teletherapy, telepsychiatry space has really allowed us to have a window into our patient's home. When we talk about safety, observation of the kids that we have taken care of in the past, we get to see their lives and see what's happening. And for our new patients, it's allowing us to engage in a way that perhaps we hadn't been able to in the office. For the kids that are reluctant to talk to us, we can talk about their pets. We can see their pets. We can see their baseball trophies. We can really engage. And so for everything that's been negative for mental health in kids, there are some silver linings. And so I wanted to keep this brief because, as I said, we don't have any data, but I'm certainly happy to answer any questions you guys have.